This episode of the Beauty Industry podcast was brought to you by Circuit Skin Australia, making skincare smarter for almost 2 decades. Hello and welcome to the Beauty Industry podcast, your online support community for the professional beauty industry. I am your host, founding director of Beauty Industry, Tamara Reid. Here we are closing the competitive gap and speaking your language. This is a platform created and dedicated to the professional beauty industry, valuing community over competition. We serve to help connect you with inspiration from industry experts, expand your knowledge through educational pieces, and bring you the latest in product and technology innovation. This is Beauty Industry. Today my guest is Dr. Martina Lavery from Martina Dental Plus Aesthetics. Dr. Martina is the principal dentist of Martina Dental and has been a dentist for over 22 years in the Hills District. She studied dentistry in her native land of Ireland before migrating to Sydney after meeting her husband in Adelaide, where she was on a forensic dentistry scholarship at Adelaide University. Dr. Martina's meticulous nature and exacting standards results in excellent outcomes for all of her patients. You'll hear by her passion today, which shines through the conversation, that she sees it as a great privilege to work on people's teeth and takes this responsibility seriously, undergoing professional training in communication, psychology, and neuropsychology so that she's better able to make her patients feel comfortable by using a caring, empathetic approach. Dr. Martina finds her greatest joy in her practising career, which has been forming relationships with patients, which she now sees her treating third generations of families. Because of her love for cosmetic dentistry and love of 5 proportions, Plus Aesthetics was born. To enhance her knowledge for her patients undergoing aesthetic treatments, Dr. Martina has studied a Diploma in Dermal Therapies and is currently studying a Master of Facial Aesthetics in the UK. In an enormous episode for you today, Martina talks about her journey from dentistry into aesthetics, shares her insights on the mouth to skin and body connection. We venture into motherhood and mindset and everything in between. And let me tell you, if you thought dentists only knew about the teeth, then this conversation is going to blow that perception right out of the water in what could be, I'm calling, my most favorite episode yet. Here's Dr. Martina and I for Beauty Industry. Dr. Martina, hello and welcome to the Beauty Industry podcast.
Good morning and thank you for having me.
The pleasure is all mine. This chat has been a long time coming because you and I are Insta friends. We have been DMing each other for a good while. And then recently I've seen you jumping on board the reels and creating so much fun in your clinic. And I'm excited to have this conversation with you today. So thank you.
Yeah, thank you for having me. I'm absolutely delighted to be here. I'm a very proud and inspired member of Beauty Industry. I think what you and your team has created, Tamara, is absolutely valuable in the industry and was a missing link for many people. And I think, during this time of COVID, where there's been so much disconnect and isolation, it has felt very empowering to be part of a greater community. So hats off to you.
Oh, goodness, you'll make me blush. Gosh, thank you.
No, not at all. It's all true.
Well, enough about me. I want to chat about you today. So let's take it back all the way to the beginning. What made you enter into the professional aesthetic and beauty industry?
Gosh, it almost seems like a different lifetime ago. I actually, like many other people, have fallen into this world of aesthetics, actually. I am very much an integrated dentist. I do a lot of pain management. I do a lot of TMJ, so that's the joint management. And I just find that, I was treating patients with pain in a good way, but I had limitations to what I could offer them. And I did some research, and in the studies, the evidence-based literature, it came up that TMJ, pain and muscle spasm in the masseter muscles can actually be alleviated and improved by the use of anti-wrinkle injections. Now, you and your audience will know, what I'm talking about, but because of the TGA, we can't actually say the name of the drug because it's a prescription-only medicine. So for all intents and purposes, we really just call that an anti-wrinkle injection. So I went along to a few courses on that and upskilled in that area and found, that I was actually having great success. Patients were feeling better. And word of mouth spread. And I think, as a dentist, my daily life is just injecting people. I spend pretty much, I would say, half of the day with a needle in my hand. And I'm very aware of the anatomy. I'm very risk averse by nature. And I'm not the type of person to just dabble. I really go all in. And so when I, was given the prescribing ability to use this drug, I then thought, why not integrate that in a dentofacial plan for the rest of the face? And patients were actually asking me, like, you're injecting my TMJ and you're injecting my masseter muscle and the other muscle around the forehead, the temporalis. Why can't you just, zap my crow's feet, or why can't you just do my glabella? And I thought, okay, let's diversify into this. And as I said, I'm not one to dabble. I like making sure that I know as much as I can. So I actually studied dermal therapy. I have a diploma in dermal therapy, not to change what I'm doing as a dentist, but to actually understand much more about the facial layers and to understand, that not just an injection is going to give an amazing aesthetic result. So it was really just to support my knowledge. And then, I started to do it, get great results. Patients, were referring other patients. And I just fell in love with it. I really have such a passion for facial aesthetics when it's integrated with dentistry. And it has just been an absolute joy to be on this trajectory. And I now find myself studying a postgraduate master's in facial aesthetics. So yes, that's how I got into it. And my clinic now has been set up with the integration of dermal therapy, and we have very much a full face approach to our treatment planning. Now, naturally, I am a dentist first and foremost, and that comes first. But for patients who are interested in enhancing their facial features, or, do want to have their masseter treated for either pain management or jawline slimming, we can do that at the same time. So yeah, it's been a wonderful addition to my practicing career. And I don't see me stopping anytime soon, actually.
Yes. Oh my goodness. What a pathway. And it sounds like you're very passionate, clearly, but
Absolutely.
what an industry, where we can go from dentistry to dermal to aesthetics and just to keep on growing. It's
Yes.
always blows my mind how many
Yes.
different pathways this industry provides.
Yes, absolutely. And, our career cannot be linear. I'm a mum of 2 young boys, and I think, you need to be a role model for them. And you have to let them realize, that your learning does not stop at the HSC. It doesn't stop at university. Every day is an opportunity to learn something new, and we do, and even just talking to patients and really getting to know them. And maybe, COVID, as much as it's been horrendous, it's really changed the learning platform for us all. Like, look at us this morning, just connecting like this. I've learned so much with online learning. Now, obviously nothing, compares to actually physically doing it, but learning behind the scenes with webinars, it's absolutely changed the whole arena of education.
Yeah, you're 100% right. I want to touch base on your education there, because what I really appreciate about you is that you've gone, okay, I understand dentistry. I can prescribe aesthetics, but what I want to do is link the two together. And you've gone and studied dermal therapy, which I know a lot of people skip that step and just, grab the needle and go straight into aesthetics. What made you want to go back and study more and do the dermals?
Well, it really isn't enough
Mm.
to inject a face. Because really, what do we have to go back to? And as a health provider, first and foremost, I think we have to go back to health.
Mm.
So and this is one of the situations where I think, no one notices a line on your face, but they will notice healthy, glowing skin. And I think education, empowering your patients or clients to have the healthiest skin, and whether that's from inside or topicals. And then, injectables is such a small part of dentofacial aesthetics. And I just thought that it wasn't enough to just go along and then start injecting on a muscle layer. We are complex beings. We have our skin, which is the outer layer, protecting, doing amazing things on a daily basis for us. And then, we have the superficial fat pad, then we have the muscle system, then we have the deeper fat pads, then we have the bone. So we have those 5 layers. And, facial aging or rejuvenation, you're really only able to target probably one of those areas if you're only doing injections, either dermal fillers or anti-wrinkle injections. And I think, as a holistic practitioner, we have to address those other layers. The facial aging is inevitable, and how you want to do it is up to you. And I think, we come across a lot of patients who feel judged, whether they're judging themselves or whether actually being judged, whether it's a perception of being judged. But we need to address the aging process. You're going to get facial laxity, which is the jowling. You're going to get a loss of volume. And then, you're also going to get surface changes. So when you only know how to pick up a needle and inject either filler to restore the volume or an injection to stop a wrinkle, you're really doing a disservice to your patients. And I think having that more integrated and full face approach, and having all of the different modalities and having the knowledge of the modalities, is going to optimize the patient results. And also, I wanted to make sure that I was going to be a safe practitioner.
Nice.
We have an industry that is, I think, probably at a crossroads. I think the model of facial aesthetics needs a lot of change. And I think we probably need to have a more structured learning program to demonstrate competency, and perhaps a framework whereby patients or clients can actually research a practitioner and say, okay, you've got 5 stars, you've got 3 ticks. I'm going to be safe with you. Like, in other countries like the UK, I'm doing my master's in the UK. So I know I'm practicing in Australia, but a lot of the knowledge comes from the UK, and they have different sites and they have a level 7 certification. So I am well and truly beyond that level 7 certification. However, in Australia, we're a little bit lagging with actually having a formal qualification pathway. So I think that that's something that the industry needs to address. And I think it all comes down to knowledge, education, being a safe practitioner to optimize results for our patients. They're the ones that are going to benefit from this.
Absolutely. It's all about that accreditation.
Absolutely.
I couldn't agree with you more, and hence why, we've jumped on ABIC, Aesthetic and Beauty Industry Council, just to kind of increase that regulation and to make sure that, everyone in our industry is doing the right thing from an industry point of view, but also for the safety of the client, and also so that a client can jump onto a website and go, okay, this is rated 4 stars or 5 stars, or these guys are accredited bronze, platinum, gold, whatever, that status is. I think that's very important, that that's transparent to the client.
Yes, and I think it is absolutely needed, and hats off to you and your team. And I'm very proud to be a member in our clinic, to be affiliated with you guys. And I think it's going to just benefit the public. And I think also having a network where, you can actually bounce ideas off each other. And at the end of the day, there are no risk-free treatments. Yes. Every treatment, whether it's an injectable, whether it's a filler, whether it's a resurfacing treatment, carries risk. There are complications that go along with any intervention, whether it's a medical intervention or aesthetic intervention. There are going to be risks and complications, and we have to get good at complication management.
Absolutely. Absolutely. Now, I'm sitting here looking at your face on video.
Okay. Don't be too harsh, Tamara.
Stick with me here for a moment, right? And as you were saying before, we've got bone, muscle, fat, skin, and we know the layers, and we know those layers very well as beauty and as dermal and in the aesthetics industry. But looking at your face, the teeth in that lower half really does take up quite a good amount of space of the face. Do you think that perhaps, from a beauty and dermal space, we aren't looking at the teeth or that bottom half of the face enough for our clients?
I think it's changing. I think, with social media and celebrities, we are probably becoming a little bit more aware of the lower face. But for me, as a practicing dentist for the last 22 years, it is the first thing that I notice.
Yes.
I will always go to the lower face. And especially if I meet a new patient, when I go to the lower face and I say, what about your chin? Or, have you noticed this little line here? Or do you feel, that you would like to have, a better sculpted jawline and it will sit within your face? They're like, oh, I've never thought about that before. I just thought injections were like for your cheeks and your forehead and I've never on your lips, and I've never really thought about your lower face. So I think I am absolutely programmed to look at the lower face. And it's definitely one of my favorite places to treat. I love treating the perioral complex. And I think, the perioral complex, peri meaning around, oral being the mouth, and then complex, it is actually a complex area. And it is a very high risk area to treat because of the anatomy and also because of your facial muscles. So, on the upper face, if you're doing some anti-wrinkle injections and you really dose it up high or you do a lot, what's the worst thing that could happen? Your frontalis muscle, which is the muscle on your forehead, maybe won't hold up those eyebrows, and you might not just have that great, arched eyebrow, and the patient may not be happy and not return. And, what's the worst that can happen? But in the lower face, those muscles are needed. They are functional muscles. They're mimetic muscles. They're needed for facial movement. So we can't overdose them, firstly. We can't inject in the wrong muscle. Because, for example, the muscle here, the depressor anglioris, which gives us a marionette line, it pulls down the corner of the lip. We can really successfully treat that, much nicer than filler, actually. But we can do that, and we can stop that muscle from happening. But the next door neighbor is a depressor muscle. And, if you hit that muscle, then the patient has an asymmetric smile for 3 months for the duration of the toxin. So you really have to be very careful. And also you don't want to completely paralyze the activity, because we want to be able to smile, eat, chew, use a straw, kiss, and actually present an expressive face to your family and friends and your work colleagues. So otherwise you just start to look weird. You feel weird, you look weird. So I think you do have to be very careful in the lower face, but I think you can achieve great harmonization of the face through using the lower face as a scaffold to enhance the rest of the face. And I think it really is all about looking at the patient's features, trying to get them into a proportion that is balanced, and just making sure that you're doing things that will actually complement that patient's features, as opposed to doing something that will make them look odd. I think respecting anatomy and respecting a person's natural beauty is really important. I'm a very subtle practitioner. I'm a very risk-averse person, and I'm very subtle in my approach. And that's not for everyone. So you find your clients and you find where you're happy to treat. And I think you must stay true to what you believe.
Yes. And I love the word you've used there, respect. I respect the facial features, because we are born a certain way.
Yes.
Obviously we can tweak it or slightly enhance it, but I think, a lip is a lip is a lip.
Absolutely.
It's all the same size. We shouldn't overcomplicate what the face looks like. And I think there are a lot of practitioners out there who are over treating. And, I see these poor women and also men as well nowadays walking around, and they look, their lips are so swollen, and I think,
yes,
oh my goodness, there's so much filler in there. And I've even read notes of cosmetic practitioners who say, put a meal in, client requested more, she's going to go elsewhere if I didn't put in, another half of meal, have advised the client, do not treat, do not have any more, but I think there's a big addiction around more and more
yes,
is more.
yes.
I've heard you speak about on your Instagram the golden ratio, and I want to touch base with you. For those who don't know, what is that, and what are those kind of principles?
Tamara, it's really interesting you asked me about this, because this is pure mathematics. And my dad is a maths teacher. And he said to me when I was growing up, Martina, maths is everywhere. And I just said, just tell me how to do it. I just want to pass the exam. I really don't like maths. But look, phi is a mathematical formulation. The golden ratio is a mathematical formulation, and it actually equals 1.618. It is actually, it's found everywhere in nature. So snails in their shell have phi ratio. So if I really just bore the audience currently and go back to actually what phi is, it's a special number that is 1.618, and it originates from the Fibonacci sequence, which is obviously from all the Renaissance masters when they were doing all their sculptures and their works. And technically, it is when you divide a line in two parts, that the longer part, which is A, is divided by the smaller part, which is B, and then that is equal to the sum of A and B together, divided by A. That's how we get 1.618. So I'm sure I've lost everyone. But how that has clinical and real life meaning is that, there's never been a one size fits all approach for design. But there is like this concrete mathematical approach that can help us get closer to creating amazing experiences and amazing ratios every time we do treatments, and that is the golden ratio. And we have things that we use. So I'm very much a full face approach person. Now, whether we treat that full face, that's up to the person. But for me not to guide that person, but what their ideal ratio of their facial features and the proportions would be wrong. Because if we work within that framework of the golden ratio, you will never look done. You will never look odd. You will just look enhanced. We actually measure it. I have calipers that I use every day, and we actually use the intercanthal distance. So the intercanthal distance is the distance between your two eyes where you get your little sleepy dreams. So from there to the other side, that's called the intercanthal distance. And that actually stays as a true static measurement. And then every other feature in the face is actually related to that measurement. So the intercanthal distance, the nostrils of a female should be the same. That would be phi. So that would be that 1.618. Then the tip of the chin would be phi related to that. And then we work out, where would be the ideal placement of a cheekbone? Where should your jawline sit? So, the ideal facial proportion is everyone's trying to achieve that heart-shaped face. And that's where the cheekbones, the zygomatic width, is actually wider than the gonial width, which is the jawline width. When you actually feel your jawline there, that muscle on the edge, that should be a little bit more narrow. And the chin, if we divide up our face, we divide it into horizontal thirds, which is the forehead. Then we have the middle of the face, and then we have under the nose to the chin. That's the thirds horizontally. But what's actually critical is dividing the face into vertical fifths. So we draw a line down the face, and all our main features, our prominent features, should stay within that middle fifth. So that all of the action of the face, like the lips and the nose and the chin, should sit within that middle fifth. And that gives us a lot of attention when we do a lip sculpt. We shouldn't be bringing filler out onto the corners of the lips because it's not actually natural. It's not actually respecting the natural anatomy of your lip. We were born with lips. I think we should always be going back to origins. We need to go back to embryology. In genomic paleodontology, the lips, the lower lip develops from a different structure and layer than the upper lip. That's why the lower lip, interestingly, you can put filler on one side of your lip and it will run right the way to the other side. Wow. Because that's all a connected compartment. The upper lip has two very separate compartments separated in the midline by your Cupid's bow. Mm. That's why when you inject on one side, it doesn't automatically flow to the other side because that is your natural embryology. So I think it's like anything. We must go back to origins. And actually, did you know, when I was doing a little bit of research for this podcast, did you know that actually teeth developed from the dermal layer? Teeth developed from the enamel, actually developed from the dermal layer, which is, we were born from three different layers, ectodermal layer, the endoderm, and it all has come from the ectoderm. So, teeth and skin are not that separated after all. If we go back all those years, let's respect our origins and let's, stay true to what your body does. We're amazing creatures. Why do we feel like we need to make ourselves look alien-like? These trends that we see now on social media, fox eyes or Russian lips or devil's lips. It's just ridiculous.
After the break, Dr. Martina and I explore how therapists can recognize skin conditions relating to the teeth. And I ask when and if we should be prescribing to a dentist before diving headfirst into a wealth of advice on Martina's life lessons. But first, a word from today's beauty partner. Community, if you are searching for a skincare brand to stock in your space, then you should look no further than Circuit Skin. The original skincare brand is back in Australia, bigger and better than ever before. With over 20 years of research and development, happy clients treating all concerns through ingredients which are considered through their earth-aware conscious ethics, Circuit Skin is a brand your retail offering and treatment menu is going to love. Promoting professional prescriptions by skincare specialists rather than selling online, Circuit Skin is the perfect combination of results meets relaxation in their signature eye-catching yet eco-friendly packaging. To find out more about why so many therapists and clients are loving the return of Circuit Skin via distribution of InMed Aesthetics, visit www.circuitskin, that's circuit with an s.com.au to take a look for yourself. Thank you so much to the team at InMed Aesthetics for making today's episode possible. And now back to Dr. Martina. And you're taking me back there as you're talking to a consultation I had with my dentist a few years ago, where he was saying the top half or the top 2/3 of the face kind of stay the same structurally, but your bottom half of the face, your jaw, which includes your lip, that moves forward and back. And obviously that contains the bottom teeth as well. So
Absolutely.
it made a lot of sense that you were saying the bottom lip is completely different to the top lip, because the bottom lip has to move, it has to shift and allow for those teeth and that jaw to shift as well, which is, you've just given me that light bulb moment there.
Yeah, that's right. And, as we age, we lose our, we get atrophy in the mandible, in the lower jaw. So we tend to get recession of the jaw. And, the teeth are extremely important in how the jaw presents, because our teeth actually keep the jawbone. When we don't have teeth, we don't have a jawbone at the right height. So when a tooth is removed, the actual jawbone where that root of that tooth was housed recedes. So it's called resorbing. So having your teeth in the right position and in the best health actually will enhance your jawbone health and the strength of the jawbone, actually, because when we use our teeth, when we bite together, we're actually loading your bone so that we can actually make it stronger. And that's another thing, we find a lot of people who are grinding their teeth or clenching their teeth, the masseter muscle becomes really strong, but the jaw density actually increases as well. I'm a big masseter grinder. So I'm very passionate about this, actually. It's something that I tend to, it's just a normal part of my consultation. Like my dental consultation has always been about the external structures as well. And I noticed when I used to work in other clinics and the nurse would go, oh, well, you do that. Oh, that's really good. Or a patient will come and they'll be a little bit concerned that I'm feeling their lymph nodes, or I'm feeling their jaw movement, or I'm asking them to do tongue acrobatics and asking them to move their tongue all the way around the mouth. But actually doing an oral cancer screen inside is extremely important. I have picked up 2 in my career.
Wow.
And also, checking for swellings in the glands and underneath the jawline, and just checking even the thyroid sitting there. Sometimes you can feel a little nodule, and that can be intercepted with the necessary referrals and getting specialists onto that. So I've always had an integrated approach. Like, I think it's great, that we can all do a filling. I mean, I really don't think anyone should be getting a pat on the back for doing a filling or doing a crown or doing a root canal. I mean, that is what my certificate on the wall says that I can do. But for me, the true magic is actually the integration of your teeth with your overall health and your lifestyle, and actually educating patients in how they can change their behavior to enhance their health. I think that's where the real joy in my practicing career has been, not about doing a filling. Yes, of course, that absolutely must be done. But I think diagnosis, management of the patient, and creating relationships, long-lasting relationships that are built on trust, integrity, and quality care are where the real joy and the magic of being a dentist is.
Can you be my dentist?
Please, yes. Yes, I love a holiday. Not the first time I've been asked. I've been asked to go on a cruise with someone.
Oh my goodness.
Yeah.
So very cool.
I know. I love my patients. They're absolute, I just love them. I really have always felt it an honor to put my fingers in someone's mouth. I think it is the most invasive, most vulnerable thing that you can do to another human being in a professional capacity. And my son, I mean, getting back to being a new mum, my first son was born very, very unwell. And he was in intensive care for a very long time. And it was actually touch and go for him for quite a few days.
Right.
And, I willed him on and I said, come on, stop this nonsense. We want to take you home and, we want to, have fun with you and see you grow up into a beautiful boy. And he listened and he took a breath and the rest is history. But I vowed from that day. I had been a dentist for maybe 8 years before I had my son. And I vowed from that day, I just handed up this baby in intensive care, full of tubes and in an incubator to these professionals. I put my absolute faith and trust in them that they would do a good job for him and for us, and that they would do everything they could to keep him healthy. And I changed that day. When I brought that child home and when I came back from maternity leave, I was a different practitioner.
Right.
And I think, there are things in your life that you go through that actually make you stronger and make you better. And that was definitely one of those lighthouse moments for me. And I always reflect upon that time that I put my absolute faith in those doctors, midwives, who were amazing, actually. And I then found myself that was what people were doing with me. They would come to me with their child. Now, obviously, it's not critical, although sometimes it actually can be. I have had patients admitted critically for cellulitis and things like that, and have been in hospital with drains for chronic infections. But in those moments when a parent is asking you about the well-being of their child or their mother-in-law whose health is compromised, I think it really has made me realize that I have to do the absolute right thing every time and make the right judgment call. So I think doing the right thing, behaving ethically, whether it is doing a filling or a checkup or whether it is doing a full face rejuvenation for a patient, I have the same philosophy.
Yes. Oh my goodness. Just you're reminding me there. We had a lot of complications with our son Jackson as well. And I didn't get to see him until 2.5 hours after the birth. And you're reminding me, walking back through that NICU kind of area and seeing him in a little incubator, and then watching the chiropractor and also LC lactation consultant put their hands in his mouth and like press down on the tongue and, do all these types of things. It is such an invasive area, and it's kind of like, when you really think about it, how many people have had their hands in your mouth? Not many.
That's right.
Anyone can touch you on the back or the arm or the leg or with the head or wherever, but inside that mouth, it really is quite a privilege. I never really thought about it that way.
And every day I really think at the end of the day, wow, I've put my hand in a lot of people's mouths, and it is absolutely terrifying for some people who say, for example, they feel that loss of control. You're already anxious. Every day I respect what I do. Every day I think it's an absolute honor and privilege that someone sits in my dental chair and puts their trust in me in such an invasive way. And I will carry that with me until I hang up my drill.
Yeah, that's so special.
Or my needles or whatever I'm going to hang up. Yeah.
So we've talked about the skin and the teeth. Talk to me about the body and the mouth, because that's, again, something that you are so passionate about. Is there any significance here, do you think, or how do you kind of look at the two to be related?
Now, Tamara, is this going to be a series of podcasts with me? Because how long do you have on this topic?
I know. I feel like this could go, me and you could just chat. I mean, you and I, rather. We could chat for days.
This could be like a part 2. Stay tuned. Look, I have always believed that the mouth is absolutely the gatekeeper of the body. And we are finding out more and more in the research how your mouth and how the health of your mouth is related to other diseases such as chronic diseases And I think it all really goes back to inflammation and bacteria and the immune system. And part of my dermal therapies, actually, I did a certificate in dermal health and gut health. And I find that so interesting because how can we examine the gut without examining the mouth?
Yes.
I mean, that just does not make sense. We must think the gut begins with your mouth. We must think about the mouth as the gatekeeper to the body, really. It has such a functional role in protecting us every day. And I think we should really, just stop and think about what it does for you every day, even from the physical aspect of not, allowing pathogens in, and then we get into the bacteria and how we fight pathogens that come in any way, shape, or form. So I really have always believed that there's a great integration, and my passion is treating gum health as well. And there is 100% a link to the bacteria in the mouth and related to chronic diseases such as diabetes. We used to think that diabetes was, just caused just by sugar, but we do know now that bacteria in the mouth actually cause diabetic symptoms, and then the other way around. So if you have diabetes, you're more likely to actually have periodontal or gum disease. And it actually is one of the screening tools that we use, and usually refer patients off to the doctor to get tested. And we usually find that they come back. And I think, it's very much misunderstood that your oral health has such a significant impact on your overall well-being. And just one of the recent studies actually coming out of the Lancet in the UK is how our mouth, so our oral microbiome, is affecting fertility. So fertility rates have halved from 1965 to 2017, and that's predicted to continue to decline. And so we have actually found out some new research, and there is actually a current clinical study going on in the UK for this, that it actually can affect male and female fertility.
Wow.
And so when we have gum disease or we have decay in our mouth, it affects the mouth bacteria. So there's a dysbiosis, dys just meaning it's not in sync, everything's in chaos. And this actually can affect the fertility. So they are actually trialing a probiotic mouthwash currently to rebalance the oral bacteria and the gut microbiome. And they're finding, that some of the ingredients in the probiotics, such as the biofidum bacterium bifidum and the Enterococcus faecium and Streptococcus thermophilus, they actually can inhibit oral bacteria such as Porphyromonas gingivalis, which is one of the big ones in gum disease. And I've always, any patient who's presented with gum disease, I've always recommended that they have probiotics. And I think, a lot of the times we talk about poo and patients think, oh my gosh, am I in the right clinic? But I think having a holistic, I feel like sometimes people think holistic, oh, a hippie. It's not, it's being integrated. It's being sensible and thinking beyond teeth. And, they actually are finding that will actually help with the local inflammation in the mouth. There's a decrease in the interleukins, which are responsible for inflammation. And, we think about even things like, the sugar consumption. We're thinking about being healthy, overall well-being. And we know that sugar is addictive, and we know that sugar will increase inflammation through glycation pathways, and glycation products that will deteriorate skin health. But if we are thinking about sugar consumption in relation to skin, we also need to think about sugar consumption in related to dental decay. And there is a link. So I think we really should be trying to decrease inflammation. I always say to patients, think about you putting out a fire, currently on fire. You really want to smolder, and then you want to get into a state of remission. You want to increase the body's ability to heal itself, and it can't do that when it's inflamed and hot.
Yes. Oh my goodness. I'm telling lots of different stories today about my baby son, but you've just reminded me again that when we were in the hospital, as I said, there were lots of complications with his birth, and both he and I were given antibiotics the second he came out.
Yes.
And of course, for a baby, that's dire straits, because they're supposed to open their mouth as they come out of the birth canal, and that's when they take in all of the good bacteria. But if you're giving antibiotics to a baby, obviously that just is kind of redundant, right? But the nurse said to me they did a bacterial swab inside of my mouth and said to me, you've got a lot of good bacteria, and we can tell by the health of your teeth that actually, and this might be gross for some, so if you're a bit grossed out, sorry in advance, but they said when he starts eating at about 6 months old, you can do what's called kiss feeding. So basically you chew the food in your mouth and then you kiss like a bird would into the baby's mouth. And while you're chewing, all your saliva, which is that good bacteria, is going to go into your baby's mouth, and then that's going to strengthen up his gut and give him the good microbes. And I was like, oh my goodness, that's disgusting, but the more I've looked into it, I'm seeing so many positive reviews about, increasing the good bacteria into him, helping with the tummy, decreasing the inflammation, all just through the mouth, which is just so fascinating.
Absolutely. It's so interesting. And, as a mum, okay, getting back to your first point, mother's guilt is just always there, right? From the get-go.
Yeah.
Like even when the baby's not even born, you're guilty of what have we done, during pregnancy. And I am a mum. I am a dentist. I'm a facial aesthetics practitioner, but I am a mum as well. And mother's guilt is just always there, regardless of what you do. So, feeling guilty, that he's having antibiotics, like, my oldest son, he's going to be mortified actually, me talking about this, because he's a teenager now, but like he was pumped, and I mean pumped, full of antibiotics.
Yeah.
And I'm standing there as a dentist and as a mum, and I'm thinking, oh my gosh, his 6-year molars are going to be shot to pieces because that gentamicin is going to give him enamel hyperplasia, which is like when the enamel doesn't form. And then my mother hat on, like, oh, I really hope, that you're going to get well and keep going. And, so we can't win. And there is a lot of research actually going into that KISS technique. And it works for someone who's healthy like you. And you've obviously maintained your oral health, and you've done a great job of that. And you've really got a good, healthy microbiome in your mouth. But actually the reverse can happen as well. So we have actually found that people who have gum disease, who have been clinically diagnosed with the bacteria related to gum disease, their children are much, much more likely to exhibit signs of gingivitis and gum disease in their early life because of the transfer of bacteria. So I think we have to think of bacteria. Perhaps COVID has made us very aware of transmission of bacteria.
Absolutely.
But, every day I'm just programmed to think about bacteria. And when I'm looking at someone's gums, I'm actually thinking about, how does that look under a microscope? How does that look under, how would that be? And we find that if I say to someone, this plaque that you have in your mouth, if I put it under a microscope, it's moving. I can see creepy crawlies in it. And they're like, what? So I think we have to think of some of your mouth and the plaque and the bacteria being alive and thinking about it from a microscopic point of view. And just before we digress onto another topic, I find it fascinating that a recent study has actually showed that where you were pointing before, Tamara, where you would sample the bacteria from your own mouth, from the cheek and the tongue, that family of bacteria, that microbiome, actually is different to the bacteria that you would find on your gum line where you have plaque.
Wow.
So even our body in a same environment, but on two different separate structures, like a tongue or a cheek, can have a different family or colony of bacteria. And obviously there are good bacteria, but the bacteria on the plaque and on the gum that's inflamed is the bad bacteria. And what we're trying to do is optimize the good bacteria.
Oh my goodness. I want to be a dentist. This is so cool. I want to go back to skin for a second, because you were
Sure.
talking before about inflammation and, advanced glycation end products and, obviously wrinkles and creases that we see on the skin. Do you think there's ever an opportunity or an open, and is it even feasible that a therapist could look at the skin and may refer onto a dentist, or, may suggest that a client see somebody like yourself?
I do. I think a therapist who has an integrated approach would absolutely be thinking that way, to optimize the outcome of the intervention that they're going to use to help the client get healthier skin. So we have so many, as I said, the enamel of the tooth originated in the dermal layer. And, we can have a patient who has presented to a dermal therapist who has acne. And then we find that actually the oral cavity, so the brushing is not good. And then we get this cross contamination of bacteria. And, when we may find that that person gets supplemented, perhaps by probiotics, prebiotics, zinc, vitamin B5, we find actually that can actually help the gum as well. So,
Right.
and there are lots of conditions. I mean, obviously, there is that crossover with the dermal therapist, dermal clinician, and dermatologist. But I think if we have a good team really thinking outside the box and trying to manage the patient to get optimal results, particularly like a condition like acne, or eczema, we can't find that these are all at the root of inflammation and oxidation, and all of the stressors on the body where the cells are not functioning optimally. So, and also, you can have aging through glycation. If you're seeing that on the skin, I mean, that has a very typical presentation. That's just toxic. The body is just toxic when it's sitting like that. So you will find that there will be a toxic link with the gums as well. And if you've got increased sugar consumption, then perhaps there will be a decay risk. So I think, there is always scope to have a multidisciplinary approach. And I think at the end of the day, we must always have the end goal for the patient or the client as our priority. And I think, having the ability to step back and say, this is not my domain, and you would be better seeing, one of the referrers, or, taking the ego, I guess, out of the situation and really making sure that the pinnacle of your focus is actually going to be the patient. And that's really how I think you grow yourself. You grow yourself by acknowledging your limitations and your strengths, but also you grow in trust with those patients as well, because they understand that you have their best interests at heart. And that's always where I come from. That will always be my practicing philosophy. And, I guess, yes, it's all just really about the skin is related, skin health, the external presentation is related to the internal, what's going on. And that's the same with your mouth health as well. And I think, we don't appreciate that our skin is an organ. It's a functioning organ. It's a very large organ. And what affects its health can affect other systems in the body as well.
Can you imagine thinking back to Dr. Martina prior to even being called Dr. Martina, studying for dental, that this is where your pathway and your trajectory would actually land you? I mean, it feels like you've come such a long way since being a dentist, and you really take that integrated approach. Could you have ever foreseen that this is where your industry, you would land in the industry?
No, it's just amazing, the trajectory of my career. My parents sacrificed a lot to send me to university, but I was surrounded by books. Both my parents were teachers. My mom worked in a preschool. That she had her own business, very hardworking, instilled a really good work ethic in me. And I was always a good student. I was just a science nerd. And I always knew that I wanted to do something in science. So I actually started doing medicine, actually.
Mm.
And then I had to work, to earn some money. And I worked in a palliative care unit, which is probably not the best idea, but it did change my idea about doing medicine. I thought, no, that's not for me. But here I am, 22 years on in a different country. I came to Australia actually on a scholarship. The top 3 students got a scholarship to do an area of interest. And I was really interested in forensics. I mean, I obviously watched way too much of The Bill back in the UK and thought, here, I'm going to be, the next forensic dentist. And I went along and I went to Adelaide and I was under Dr. Jane Taylor and Prof. Brown, which was an amazing experience. Pretty grueling, actually, what we saw, but it was such an interesting experience. And that's actually where I met my husband. And then we went back to the UK and worked there for a few years. And then I thought I'd come to Sydney, try it for a year, see how I go. And I was used to working in the National Health Service. So being very, very busy, multitasking, we had 3 or 4 rooms going at one time. And the dentistry was very different to what it is here. And, now I sit back and I think, hard work and having a desire to have as much knowledge as you can, anything is possible. I mean, I grew up in a small fishing town in Ireland. I had 35 people in my primary school. It had 2 classrooms.
Wow.
And I think, we are the masters of our own destiny if you want to learn. And I think, education can change the world. It is a very, very powerful tool. I love acquiring knowledge. I mean, I'm in the middle of this master's at the moment, knee deep in research. I'm really very, very pro learning as much as you can. And I think you have to dig deep some days and you really have to believe in yourself. And I think my motto at the moment is everything does get done. I am a very organized person and I am a very efficient person, but I'm the type of person that I'm very organized. I'm not a deadline person. I'm always ticking the boxes, way weeks in advance, but that's not how it is anymore. And I've made peace with that because I can't juggle all these hats and wear all of these hats and be organized at everything. If I'm in the middle of a master's submission, which I am currently, I can't be making a 5-course meal. And it's really quantity rather than quality right now in my house with teenage boys. But you can't do it all. You have to prioritize. And you actually have to cut yourself some slack. And you actually have to just give yourself a pat on the back and acknowledge that you're doing a good job and that nothing is perfect. And that as long as you are striving to do your best, you can do anything. I think mindset is really everything. And you can achieve great things. And I hope, that I am remaining humble. I hope that I do appreciate actually all the gifts that have been given to me. And, I'm not a hippie by any means, but I do practice gratitude. I think gratitude is one of the most underrated philosophies and practices. Just being grateful to sit here in a lovely home with technology, to be healthy, to have 2 children that have gone to school, to have a clinic that's fully booked out, to have a beautiful team. I mean, I think we need to change our mindset. And I think, what is it they say? Nothing is impossible because even possible is in the word impossible. I mean, that's a bit cheesy, but I think we must do that. And we must also ask for help when we need it.
Yes.
I think we must allow ourselves to be vulnerable. And I think being vulnerable, we can be, we can actually really be authentic. And that's where I would say to my younger self that it's actually okay to not know it all. And it's actually okay to ask for help when you need it. And in doing so, you will grow, and you will grow in success in your own ability. Success means many different things to different people. But I think, success comes from working hard and having that inner feeling that you've done a good job. And whatever that is, whatever you're working on, be all in, be fully committed to that. And I think anything that you put your mind to, you can achieve it. Even if you think it's a huge mountain to climb, you can do it. And I think, everyone goes through tough times. I mean, we look at what's happening to our colleagues in Melbourne and all around the world. It's a hellish time. And I think, it's all about trying to think about being in the right mindset and trying to have this focus of being able to overcome adversity. I think, when I developed and started my clinic, I had this very naive approach where I thought, everything's going to be wonderful. And I'm not afraid of hard work. I'm happy to work hard. I am very hardworking. But I think what my best advice I would say to my younger self is that every day you're going to have a problem. Now, whether that problem is small or whether it's big and more significant, you need to become a good problem solver, because every day is going to be a problem, and it's just how you're going to manage that. And I think if you can get in that mindset, rather than freaking out about things, just have an actionable plan and be a problem solver, and support yourself with good mentors, support yourself with people who actually want to see you succeed, who can support you. And, I think at the end of the day, be true to you, do the right thing, and you will find your own niche in this industry.
Absolutely. Oh my goodness, you've given me goosebumps there. I was going to ask you about some lessons that you've learned, but you've just hit us with gratitude and vulnerability and authenticity and asking for help and mindset and success all in that one answer. So I feel like you've just shared so many life lessons and lots of little tidbits and magic for our audience. But did you have anything else that, if somebody is listening today, you might just want to leave them with one little golden nugget of information?
Look, I think it would be absolutely remiss of me not to mention team and people. So I think cherish your people. When you find good people, hold on tight to them like glue and do everything you can to support them. And also, don't be afraid to separate yourself from people who do not have your best interests at heart. Toxic relationships are not healthy. And that can go from mentoring to a team member to clients. I think that that's really important, to identify who is good for you, who is not, and manage that appropriately.
Absolutely. I told my husband that just yesterday. It's that you are the average sum of the 5 people you spend the most time with. So if there is somebody in that 5 that is pulling you down, then your average is also going down with that. So make sure you surround yourself with people who are more knowledgeable, who are more inspiring, who have a stronger mindset than you, so that they can lift your average.
Absolutely. And never, ever doubt the impact that you can have upon someone. You can be inspiring someone like you, Tamara. I mean, you're inspiring thousands of people throughout your platform on a daily basis. And you probably are so humble and so, you're so humble that you wouldn't even be realizing it. And, you can have such an impact on someone's day or life by just even being kind.
Yeah.
And I see anxiety through the roof. I mean, The day-to-day manifestation in my clinic of mental health disorders through presenting with facial pain, clenching, grinding, I would say, like, when we've been running the stats, because I'm doing a presentation later on in the year, and we've been running the stats, and we've actually seen this year alone, it's up by 76%, the patients presenting with pain. So, I know I'm digressing, but I think just being kind, treat people with kindness. They won't forget it. I mean, I think probably I've talked enough and you probably need to get back to your beautiful son. But I would like to finish on this quote that I use to guide me. And it is by the beautiful Maya Angelou. And it is, people will forget what you said. People will forget what you did, but people will never forget how you made them feel. And I hope that when people interact with me, whether it be in my clinic or whether it be through mentoring or training, or through, my education with my colleagues, I hope that they go away feeling better than when they came.
Absolutely. I can tell you already do that just by this podcast episode. So thank you so much for being an absolute delight to speak to, and for spending your very busy schedule and some time with us this morning. I really, really appreciate it.
Thank you, Tamara. I really appreciate it too. And I hope that, it's been enjoyable for your beautiful members to listen to.
Well, what a conversation. Were you as interested in teeth as I was? Honestly, who knew? And who knew these little toothy pegs could have such an impact on the body and on the skin? It truly goes to show that when we are treating clients, we really need to look at the entire person, including the mouth. I think I'm as inspired as ever to go out and smash this week, starting off a Monday like this, and I hope you are too. This was Dr. Martina's very first podcast recording ever, and she did such a brilliant job. So please go and tell her how much you loved the episode by sharing it on your socials or with a friend, and be sure to tag at Dr._Martina_Lavery, as well as her business page at +_aesthetics, and us, of course, so that we can see you too at Beauty Industry. We would love to continue the conversation on dentistry and aesthetics in our Facebook community, so please come and join us over in our closed group, or check out our digital magazine, which is released every month over on the Beauty Industry website, which you can find by swiping up and clicking through to the show notes. Appreciate you, your ears, and your time. Until next time, stay connected.